So nivolumab is now FDA approved for kidney cancer, but of course long-term follow-up requires a lot of time. And so now we've had, in some cases, 4 to 5 years of follow-up on the patients on these trials. And what's really impressive to us is that about a third of patients are alive at 4 years, and then for the studies for which we have follow-up beyond that at 5 years. So it looks like the term durable response is actually one we can say say now, knowing that we're looking at those long-term survivals. The other interesting thing is that those long-term benefits occurred in patients regardless of their initial response to therapy. So progressors, including those with stable disease and response, it occurred regardless of risk group. So even those poor risk who typically have the worst prognosis, some of those, the trajectory of their cancer can really be turned around, it seems, by nivolumab. And so I think the 025 study, which was the randomized phase 3 trial of nivolumab versus everolimus, is a prime opportunity for biomarker development. So when you have a randomized trial, you can really look to see what's predictive versus prognostic. So I think that's one opportunity. I think, again, looking at how adverse events relate to response is critical, right, to see if those people tend to do worse or better. And then, a variety of other sort of secondary analyses. Treatment beyond progression was a hot topic at this year's ASCO. So a lot we can still learn how to optimize how we use this drug. The second piece is it best used alone or in combination? And so those studies are cooking, and hopefully we'll be talking about that next year at ASCO.